Good afternoon, boys and girls. This is Mr. S with your Chapter 17 test review on therapy. Something that some people say, especially my wife, I may need some therapy. This was a very interesting chapter, as they all are. So right away from the get-go, this chapter will be 40 multiple choice, 1 free response. We start out with psychoanalysis and the psychodynamic theory of therapy. First, look at psychoanalysis and some of Freud's major components: resistance, repression, transference, free association. Please know Freud, and you got to know him by now. We've talked to him about him throughout the year. From there, we went into more psychodynamic, and we looked at the idea of client-centered therapy, Carl Rogers. Please know about active listening and the bit that we looked at of Carl Rogers. From there, we went to the role of behavior therapy. So know the components of behavior therapy, where we might use it, for example, helping with bedwetting, removing specific troubling symptoms, things like that. Behavior therapy, not so much into personal insight, but just changing behavior. Part of that, we can use systematic desensitization, so please know that, and its reference and how it was derived from classical conditioning. We also then looked at the idea of virtual reality exposure and how behaviorists would use that, especially in the role of phobias and fears. We talked about aversive conditioning, trying to get rid of unwanted behavior systematically, so aversive conditioning. We also looked at the role of the token economy and how the token economy is basically taking the principles of operant conditioning and used in a token economy. We then looked at cognitive therapy. Please look at the idea that in cognitive therapy, the main idea is changing how people think, get people to stop blaming themselves, that kind of idea, but the client's thought process is what changed, which is different from behavior, which where we're changing the behavior. And in theory, in a cognitive behavior therapy setting, we'd be doing both and integrating both of those. We talked about family therapy. And one of the things in family therapy to look at is what are the roles of each individual within the family social system? Mother, father, siblings, firstborn, thirdborn, hierarchy. What's our role in it and how we play out with that? When we're looking at trying to analyze therapy, and especially psychotherapy, psychodynamic therapy from that perspective, one of the things we talked about was meta-analysis. So please know what meta-analysis is and the use of it. From there, we went to the role of alternative therapy. So look at the idea of EMDR. Please look at the role of light therapy for SAD. Please look at the role of the placebo effect. And something to think about, that in many cases, the role of EMDR and some of these kind of alternative therapies, part of it may be the placebo effect, and that's how we can explain the success that people may find with it. Then we looked at the biomedical treatment or biomedical therapy, which is basically for us today drug therapy. So know in drug therapy the use of double-blind experiments, the role of drug therapy, the role of psychopharmacology, which is the study of how drugs affect the mind and behavior. And so there are drugs that will do both, how they affect the mind, how they affect the behavior. Some may just affect behavior, some just mind. So different things to look at in drug therapy depending on what we're searching for. Please know some of the more common drugs that we will talk about, things like Prozac, lithium, Xanax, Thorazine. Prozac is one of the more common drugs and more popular drugs to be used for depression, especially hopelessness, that kind of feeling. We then talked about, in the biomedical model, surgeries and basically, or more physical adaptations to the body, which would be the role of electric shock therapy, or ECT, or electroconvulsive therapy as it may be known as, and that is normally used for severe depression. We can look at the role of transcranial magnetic stimulation, where basically a magnet is placed at the brain to try to jumpstart or change electrical circuits and patterns, and that's been used in depression. Then finally, we've looked at the idea of lobotomy, which is for severe patients and only in very rare cases now, when at one time that was the more common form of therapy used. That should be it on multiple choice. The free response, I'm going to give you a patient who has a situation or a behavioral issue or emotional issue. You're going to then need to solve his problem from two different perspectives. And I'm not going to tell you which ones those are now, but they could be things like, how would the cognitive therapist versus a behavior therapist versus a psychoanalyst, that kind of thing. And I'll give you a couple different ones, and you have to tell me how each one would solve the same problem. That should be it. Any questions, let me know in class. And if not, study hard and we'll go from there.